Coming up in our program today, do men and women process pain differently? Well, some new research will shed some light specifically for women with chronic pain. Next, cancers caused by infections are more common than you might think. And lastly, a short and simple way to improve your glucose metabolism. Welcome to the Daily News. First, new research from the University of California, San Diego may explain why men and women experience pain relief differently. The study focused on chronic lower back pain. It showed that men and women rely on different biological systems for pain relief. This provides insight that could change the way we approach pain management, especially for women. According to the study, men's bodies naturally produced opioid-like compounds when relieving pain. In contrast, women use non-opioid mechanisms, suggesting that the biological pathways women rely on for pain relief differ fundamentally from men's. This discovery could help explain why opioid-based treatments like morphine and fentanyl are often less effective in women. The lead researcher points out that opioid dependence may develop because the initial dosage loses effectiveness over time, leading people to take more. He speculates that women's lower responsiveness to opioids may be a factor in their higher risk of addiction. According to the article, the study's results bring to light the biological differences in how men and women experience pain. The lead researcher claims, "This is the first clear evidence that sex-based differences in pain processing are real and must be considered when developing pain therapies." This comment highlights the urgency of addressing these differences when prescribing treatments. Next, a recent article in the Washington Post addresses a topic that doesn't always get the attention it should: infections that can cause cancer. Cancer is often thought of as a disease driven by genetics or lifestyle factors, but infections can also play a role. In fact, some estimates suggest that as many as 20% of cancer cases are caused by infectious agents like viruses and bacteria. The article looked at which infections pose the highest risk and how you can protect yourself. Let's start with H. pylori, a bacterial infection that can affect the stomach and intestines. Over half of the world's population is infected, but only a small percentage develops serious complications like ulcers. Chronic H. pylori infections can increase the risk of gastric cancer, and globally, more than 800,000 cancer cases are attributed to this infection each year. Preventing infection includes consuming clean food and water, and if necessary, treating infections with antibiotics. Then there's HPV, a common sexually transmitted infection that's linked to nearly 700,000 cancer cases worldwide each year. Vaccination has made a huge impact, reducing certain types of HPV infections by over 70% in young women in the US. Lastly, there is hepatitis B and C, which together are responsible for more than 500,000 liver cancer cases worldwide each year. Hepatitis B can be prevented with a vaccine, but unfortunately, there's no vaccine for hepatitis C. The good news is that antiviral medications can cure 95% of chronic hepatitis C infections. Studies show that treatment with these antivirals can reduce the risk of liver cancer by more than half. The best way to prevent hepatitis C is by avoiding behaviors that can spread the disease, including sharing needles, syringes, or other drug equipment, practicing poor or unsanitary procedures in healthcare facilities, engaging in sexual activity with a person who is infected with HCV, and getting unregulated tattoos or body piercings. It's clear that infections can play a role in cancer development, but prevention is possible. Vaccination, practicing good hygiene, and staying informed about treatments can significantly reduce your risk. While the connection between infections and cancer might sound concerning, remember that only a small percentage of those infected will ever develop cancer. If you have any questions or concerns, please talk to your healthcare provider about your risk factors and how to stay protected. Now for our last story, A new study reveals that just 30 minutes of light outdoor exercise can have a prolonged impact on blood sugar levels. Researchers found that a single session of aerobic exercise, like jogging, improved insulin sensitivity and significantly reduced blood sugar levels during a glucose test the next day. The study looked at 32 healthy young adults with sedentary or moderately active lifestyles. Participants did an oral glucose tolerance test twice, once after 4 days of inactivity and again the day after a 30-minute jog. And the results were clear. 1 hour after consuming glucose, blood sugar levels dropped by almost 9%. Insulin levels also decreased significantly, and measures of insulin sensitivity showed clear improvements. The lead author of the study stated, "Improvement in 1 hour post-load plasma glucose following a single session of aerobic physical activity suggests that exercise could have a direct effect on type 2 diabetes risk and cardiovascular risk." The study does have limitations, including a small sample size, and more research is needed. But the findings highlight how even short bursts of exercise can benefit your health. Those were our top stories for today. Thank you so much for joining us on the Daily News.